Okay, so besides scene safety, I would determine if the scene is safe to enter. I would determine the mechanism of injury slash the nature of illness. I would next determine the number of patients. Then I would check to see if I need any additional EMS assistance if necessary. And then I would check to see if there are any needs for extrication or precautions for the spine. Okay, so now I will be checking the visual impression of my patient. Next, I will be checking the level of responsiveness in my patient. Ma'am, can you hear me?
Yes.
Okay, so my patient needs to be alert. Okay, so now I will be determining the chief complaint of the patient, which is chest pain. All right. Next, I'll be assessing the airway and breathing. So yeah, I'll be assessing the adequate ventilation, and I'll also be initiating appropriate oxygen therapy. Okay, so next I'll be assessing her circulation. Okay, so I'll be checking her pulse for 15 seconds. Okay, so her BPM was 80 beats per minute, and her skin signs seem to be warm, dry, and a good perfusing color. All right, and I would indicate the level of priority for my patient and check to see if the patient is in need for immediate transportation based on the airway, breathing, and circulation of the patient. All right, so now I'll be moving on to OPQRST. Okay, ma'am, could you point to me where the pain is?
Right here.
Okay, and could you tell me what were you doing when the pain happened?
Yeah, so the pain started after a couple minutes of jogging
Mm-hmm.
outside.
And is this the first time that it's happened, or has it happened multiple times before?
This is the first time that it's happened.
Okay, so since this is the first time that's happened, it'll mean that this condition is acute. All right, so and do you know if there anything provoking the pain?
No.
Are you doing anything to make the pain less painful?
I've just sat down and drank water.
And is there anything that seems to make it worse?
Just like when I stand up.
Okay. And could you tell me how would you describe the pain?
It just feels sharp.
Sharp. And the pain, does it seem to be sticking around in the same place, or does it tend to travel around?
Just in one spot.
Travel around? Okay. And could you tell me from a scale of 0 to 10, how would you rate the pain?
A 6.
6? Okay. And could you tell me how long ago the pain started?
Around 15 minutes ago.
15 minutes ago? Okay. So now I'll be moving on to sample. Okay. So could you tell me if you have any allergies?
Pollen?
Pollen? And are you taking any medications?
No.
No? Okay. Do you have any previous medical conditions or problems?
Asthma?
Asthma? Okay. Do you remember what was the last thing you ate or drank?
Water.
Water? And how long ago was that?
Like 5 minutes ago.
5 minutes ago? Okay. And before the pain happened, do you remember what you were doing?
Yeah, I said that I was jogging outside.
And after a couple of minutes of jogging, that's where
I started feeling the chest pain.
Okay. So now I'll be beginning my secondary assessment. So now I'm going to auscultate. Okay. All right. Deep breath. Okay. Okay. Could you lean forward a bit? Thank you. Breathe. Okay, so her lungs seem to be clear. And you can tell me if it hurts right here, right here, right here.
No.
No? Okay. So now I'm going to listen to her heart tones. Okay, so her heart rate seems to be regular and there are no murmurs. Okay, now moving on to vital signs. I'm going to check her blood pressure now. Okay. Could you roll up your sleeve, please? Thank you. All right. Okay. Okay, there we go. Okay, so her blood pressure is 124/72. And let me take this off of you. Okay, now I'll be checking your pulse again for 15 seconds. Okay, so her heart rate is 80 beats per minute. Now her skin signs seem to be a good perfusing color. It is warm and they are dry. Okay, so her blood pressure is 124/72. Her heart rate is 80 beats per minute, strong and regular. And from what I can see, her respiratory rate is a good 12 to 20 breaths per minute and is unlabored. Okay, so now moving on to reassessment, I would demonstrate how and when to reassess the patient to determine the changes in condition. And lastly, when the EMS unit arrives, I would provide an accurate and detailed verbal report to them. And that should be it concerning the medical demonstration of a patient. If there are any things you missed, any things you noticed that I missed or I can improve on, feel free to let me know in your response video.
Was it?